This is a story which is so important bit because it is a real thing which we encountered around a year ago, and now they are almost on the brink of becoming parents. So this is a story about a couple, and the lady was having three times IVF failure, and that's how they came to me. And what was wrong in these three times? Nobody was able to catch it. They had gone through three IVF cycles. Three times they prepared their bodies. Three times they took the medication. Three times they retrieved the eggs. Three times they created the embryos. And nothing happened. No pregnancy, just heartbreak. And after third failure, they asked why this is not working for us. And here is what everybody was saying was they looked at the embryos, they looked at the sperm reports, they looked at the retrieval rate and all that, but nobody was talking that was quietly sabotaging the entire journey, her thyroid. And that's what we are talking about here today. Let me elaborate about it. She had a diagnosis of hypothyroidism borderline. She was already on medication for it. So everyone assumed that thyroid is being treated, therefore it's fine. That's a logical assumption, isn't it? It's reasonable. It's what most of the practitioners would think. But what I have learned, being in this space of fertility for nearly 25 years now, treatment and optimization are not the same thing. You can treat a condition and still not optimize it for a specific goal in front of you. In her case, the specific goal was to become pregnant. So the question was not just is her thyroid treated? The question should have been is her thyroid optimized for pregnancy? Nobody asked this question until they came to me after three failed IVF cycles. When I looked at her blood work, I saw TSH 5.2. Now, for most of the population, this TSH of 5.2 might be acceptable. It is not critically very high, it is not alarming, but here's what I know. For someone who is trying to conceive, for someone who has been through a fertility treatments, for someone whose reproductive system has been going through this IVF cycles, TSH of 5.2 is not optimal. It is not adequate. It is not a level that supports fertility. And that's a belief shift I want to make today to each one of you. Within the range does not equal optimized for fertility. Two different things. And nobody had made that distinction for her. So for three IVF cycles, she was trying to conceive with suboptimal thyroid function and nobody knew about it. Let me explain to you why thyroid matters so much. Because if you don't understand this, you might be in the same situation as this couple and your thyroid produces hormones that is important for controlling your metabolism. That is not the only thing the thyroid does. Thyroid hormones directly can affect your reproductive health. Specifically, TSH affects the pituitary gland. The pituitary gland controls FSH and LH. FSH and LH control ovulation. T4 and T3 affect progesterone production. Thyroid hormones affect the entire hormonal cascade. So when your thyroid is suboptimal, your entire reproductive system is working suboptimally. It is not at the best. Even if your FSH and LH and other reproductive hormones are technically normal because everything is interconnected, that's not the theory, that's the biology we are talking about. The research shows women with suboptimal thyroid function have irregular menstrual cycles, poor ovulation quality, reduced fertility, poor IVF outcomes, higher miscarriage rates. This couple had all of these markers because her thyroid was treated. Nobody connected the dots. Here is what haunts me about this case. She had already been through three IVF cycles, three times of hormones, injections, follicle stimulation, egg retrieval, emotional investment, financial cost, physical toll, hope and disappointment. Three times. And what if after the first cycle, if someone had asked her, is her thyroid adequately optimized for fertility? What if somebody had looked not just at where she was treated, but whether she was optimized? Because optimizing her thyroid might have changed the whole trajectory of her cycle. Maybe cycle 2 would have worked. Maybe cycle 3 wouldn't have been necessary. But instead, assumption was made her doctors are treating thyroid, so it must be fine. She went through two more cycles with suboptimal thyroid function. That's what I mean when I say a fertility workup isn't complete just because Every report has a green tick mark. Sometimes we need to ask a deeper question: is this actually optimized for this person? Not just is it within the technically normal range, because there is a huge difference. Now I need to be honest about something. Her three IVF failures weren't only caused by her thyroid. Fertility is a complex thing, multiple factors interact. Her egg quality was a factor, her uterus environment also was a factor, her stress levels were a factor, her thyroid wasn't the whole story, but it was a significant piece of the puzzle that nobody was trying to address. And this is what gets missed in conventional fertility medicine. Thyroid optimization isn't just about TSH. We need to understand this. TSH, but what's optimal for fertility? Just not normal. Free T3, is the thyroid hormone actually converting properly? Free T4, is it adequate for metabolism? Thyroid antibodies, is she having something called Hashimoto's or autoimmune thyroid issues? Clinical picture, how does she actually feel? The fatigue levels, the mental disturbance, the panic attacks, the low energy levels. Medication dosage, is it adequate or should it be adjusted? For a fertility patient, I want to see TSH somewhere in between 0.5 to 2.5, ideally 0.5 to 2, not just under 5. In the normal population who are not trying to conceive, it can be till 5. Free T3 in the upper half of the normal, not just normal. Free T3 adequate, not just acceptable. It must be in the higher range of the normal. Antibodies negative, no autoimmune thyroid disease. Medication dose optimized for fertility. This couple's TSH was 5.2. That's telling me her medication dose was too low. For a woman trying to conceive, 5.2 TSH is very high. Nobody had made that discussion. So, this is a belief shift which I want to make. Fertility preparation should not begin when the IVF stimulation begins. It should begin before, because your body needs that time to adjust to the new medication or the hormones. It has to begin before another retrieval, another transfer. You prepare the person, not just the procedure, right? For this couple, that would have meant optimizing her thyroid before cycle 2, not just treating it but optimizing it, getting TSH range to 1.5 to 2, adjusting medication dosage, checking free T4, testing thyroid antibodies, making sure her thyroid was ready for pregnancy. Supporting her egg quality during this time by using supplements like coenzyme Q10, vitamins and minerals, antioxidants, vitamin B9 or folic acid, supporting her metabolic health through proper nutrition, stress management, sleep, optimization, supporting her uterus environment, that is herbs for circulation and adequate tissue health, supporting her partner's sperm health. That is equally important, because understand the embryo is a product of equal number of chromosomes from the mother and the father. So then after 3 to 6 months of preparation, when her thyroid was optimized and her body was ready, do the IVF if necessary. Not like let us do this cycle and the thyroid can be figured out all by itself. It doesn't happen that way. Let's optimize the thyroid, prepare the body, and then do the cycle. That's the difference. That could have changed everything for this couple who had this painful experience of 3 IVF failures. This case represents something I see over and over in many cases. Couples going through failed IVF cycles while overlooking foundational health issues. Because understand, it's just not about the thyroid. Sometimes it can be undiagnosed nutrition deficiencies, chronic inflammation nobody is talking about, stress levels that are sabotaging fertility, sleep disruption affecting hormone production, metabolic dysfunction reducing egg quality, circadian rhythm disruption from your lifestyle. But the pattern is same. Everybody focus on the procedure of IVF. Nobody focuses on the preparation of the male partner and the female partner. Everybody has a plan for what protocol to be used for retrieval and transfer immediately or later. Nobody has a plan for optimizing the person. They think that eating clean, sleeping little bit good, and eating fresh and clean produce, organic ones, is enough. No, friends, it is just not enough. You need to do a bit more than that. So when the cycle fails, the answer is obviously try again. It may seem so easy to hear, but it is not that easy to go through one more cycle. I met one couple yesterday, and they had this IVF failure last month, and the lady was completely shattered because she had saved every single penny from her uh, salary or stipend. What she's on student visa in the UK, and she was trying to do start a family with her husband, and he has some challenges with the sperm. So they had put all their savings into this IVF process, and they were completely shattered because they were not prepared enough. So now, if your IVF cycles are failing, before you do another one, ask yourself, is my thyroid optimized? Not treated, it is optimized. Is my egg quality supported well? Is my uterine environment prepared? Is his sperm health supported? Am I sleeping well? It is very critical for hormone production. Am I managing stress? It's equally critical for reproductive hormones. Is my nutrition nourishing my fertility, not sabotaging it? Is my metabolism functioning, or is it in a shutdown situation? If the answer to all of this is yes, then your IVF has a better chance. If you are answering no to several of this, then another IVF cycle might fail just like the last one. Because the procedure is not the problem, the preparation is. So for this couple, what we did is we optimized her thyroid. It took about 2 months for medication adjustment and retesting, and we spent another 4 months on preparing her body. They did their fourth IVF cycle as well, different protocol, same clinic, but different preparation. For the first time, they had more normal looking embryos. I can't promise whether it led to pregnancy, but what I can promise is they had done something different. They had asked, what haven't we optimized, instead of just we should try again. That question changed their approach, and that's what I want for each one of you. Whether you are about to do a IVF cycle 2 or cycle 7, before you schedule the retrieval, what have we not optimized? This should be the question for both the partners, because sometimes that question changes everything. And if you're someone with hypothyroidism and you have had IVF failures, please get your thyroid checked by someone who understands fertility. Not just is it treated, is it optimized for pregnancy? Because that conversation might be the missing piece. I know this might feel heavy, 3 IVF failures, and the answer was we missed something very basic. And here's the hopeful part: once you identify what you have missed, you can address it, and the preparation changes everything. So, if you are about to go for your next IVF cycle, don't just schedule it, prepare your body, optimize your thyroid, support your egg quality, support your sperm quality, prepare your body, then do the cycle. Because I truly believe that the preparation before protocol changes the outcomes. Now, there may be a few questions like, how do I know if my thyroid is optimized? What is there? What is a normal range for TSH? How long does it take for thyroid optimization? Should I ask my clinic about it? My doctor said thyroid is fine. Should I get a second opinion? What if I don't have thyroid diagnosis but I'm having fertility problems? If you got any of these questions, feel free to write to me on my messages or in the comment section so that I can answer to you to give you that clarity. If you're watching and thinking this might be me, I need help understanding my thyroid or other any fertility parameters, I do offer a 15 minutes free clarity call to make you understand what must be going wrong in your approach. So you can reach out to me, we can look at your specific situation, because sometimes the missing piece is something very simple, and correcting that simple missing piece can change the outcomes for your entire journey. Hope you understood the message of this live today is what is the missing piece if you are having recurrent IVF failures. So see you again with similar interesting topic. Have a nice day, and feel free to reach out to me if you're struggling with this kind of issues.